Can you all hear me?
Oh, yeah.
I'm assuming you're good. I'm assuming you're all here.
Yep.
Can you mute yourselves, please, everyone? Great. You can take your masks off now. You won't be able to smell anything, I should say. Normally, at least one of you would have fainted by this point. The lack of air and the smell of death. If one of you is on the floor by the time this session's over, I haven't been doing my job properly. God, I miss doing this in person. Right, now I don't have the pleasure of making the most nervous of you make the first cut, so I've done it myself. Oh, take off your masks, for the love of God. Come on, deep breaths. In and out, that's it. In and out, in and hold. Google said if you could do that for 10 seconds, your lungs are in pretty good shape, didn't it? Such bullshit. I mean, I can hold my breath for 25 seconds. And I've been smoking since I was 15. Filthy. This one, though. The lung. Let's look at the right lung. Look at how the main artery here has been occluded. And here. Can anyone describe what's happened here?
Arterial thrombosis.
Good. And what's the pathological process that gets us there?
The virus inflames the air sacs in the lung, causes inflammation of the pulmonary alveoli,
which in turn causes the patient to cough. When enough of the alveoli are occluded, gas exchange is compromised and the patient struggles to breathe. Oxygen levels in the blood are reduced. When they're reduced by 30%, we start to notice differences in efficiency in the function of the main organs. Yes? In what order do they fail? Anyone?
Brain, kidney, liver, heart.
Excellent. Induced coma, organ failure, etc., etc. Not much fun. But back to the beginning again. To the lungs. Lungs. Clear evidence of trauma. Don't write this down though, not yet. It is apparent from the state of the extremities and other organs, the lack of oxygen was a major contributor to death. However, there must be other factors. It's our job to find them. For example, was there a history of diabetes?
No.
Shame. That can be helpful in a situation like this, you know. Any family history of heart failure? We should be so lucky. No. No? No. Asthma. Can we say asthma?
You should write that down.
Good. Suspected contributing factors including asthma. Excellent. Other factors common to height and age, yada yada. That the kind of thing you're looking for, Governor?
That's exactly what we need. No one major contributing factor. It's too sensitive.
But that isn't what happened. Of course there was a major contributing factor. We all saw it.
Young lady, it would be better for everyone if you kept your opinions to yourself. You were saying, Doctor.
We all saw the video.
Well, you've all seen what I've seen. A series of contributing factors. Difficult to just single out one cause.
It's messed up. I'm not doing this.
Shall we examine the neck?
There is evidence of severe and sustained trauma in the area of the neck. The trachea has been crushed almost beyond function. What did the last team say?
A series of contributing factors with no one definable cause of death.
They seriously said that? No, that's not what we can clearly see. Have any of you ever seen this level of blunt force trauma on the neck like this before? Anyone? I mean, things like this don't just happen, okay? Things like this are done to people.
How should we document this?
Meticulously. We have got to make sure that our report is more detailed than theirs. I've seen some things. I mean, you see some things in this job, of course, but this is something else. It's almost as if... I'm sorry. I do try to stay detached. It's the only way to do the job and to do it well, but my mum lived next door for 20 years. She's only just moved away. It was a good area. It is a good area. Lots of families there. Old families, you know, ones that have been there for a really long time. Everyone knows each other, looks out for each other. Sounds like a cliche, but it's true. I'm sorry, forgive me.
You're right.
Yeah, I'm fine. I'm fine. Let's continue. I want to draw your attention to the lungs. There are pictures in the evidence files for those who wish to view them. Now, in this case, we can clearly observe the effects of breathing in particles released by the early stages of the event. May I ask my colleague a question?
Go ahead.
Dr. Sharma, how long would it have taken for asphyxiation to occur, considering the levels of toxicity?
Based on the evidence, I am confident there would have been smoke exposure for approximately 20 minutes before lung function ceased.
What would the individual have experienced in those 20 minutes?
There would have been shortness of breath, of course, which would have increased with the number of particles in the air. However, in this case, there were additional toxic chemicals present. I understand that one of the neighbours was a photographer and had darkroom chemicals stored in his flat. These, when subjected to heat, would also have been inhaled. This would decrease the victim's surfactant levels, leading to widespread microatelectasis, leading to issues with ventilation-perfusion mismatch.
In simpler language.
The body would have effectively been poisoned.
Thank you, Dr. Sharma.
But given the evidence already presented in this panel, Dr. Jenkins, do you think the government made the right decision?
Sorry, I'd muted myself then. Can everyone hear me?
Easily done. We can hear you. Carry on.
Well, my opinion is that a shutdown a week before could have saved up to 20,000 lives and a further several thousand intubations.
Yes, that's a very good point. When we talk about deaths, we should also consider intubations. Not simply a case of either dying or being completely fine, is it?
Being intubated and mechanically ventilated takes a considerable toll on the body.
And for the lay members of the committee?
Well, the body must be sedated in order for a tube to be inserted into the trachea. Plastic tube will deliver oxygen to the patient, but it doesn't in every case deliver enough oxygen to avoid damage, organ damage. It's important to note as well that even in patients that were not intubated, there's considerable long-term damage to the lungs. There's still so much we don't know about the effects of the virus, why some people suffer so much.
So you don't believe that the government's actions were timely?
I do not.
Do you believe that the government's actions were driven by politics?
Can I remind you that it is not customary for a witness to ask questions?
Do you believe, thank you, Minister, that the government's actions prioritise the health of its people?
I do not.
If you're going to continue in this manner, Dr. Tulp, I'll have to ask you to leave. Strike that last comment from the record, please. Shall we move on? Dr. Tulp, can you please outline the progress of the vaccine trial for the committee?
Of course. We've made considerable progress and have now moved into human trials. As you can see, we have a number of participants who've all been exposed to the virus, but are so far presenting no symptoms.
How many participants?
4 so far.
And when was the last test?
I'm sorry, test? I said they were asymptomatic. I didn't say anything about getting a test. I mean, have you tried getting hold of a test?
Surely, as part of the premier vaccine trial, you have access to the appropriate testing equipment.
And surely, down on the wards, they're not still reliant on PPE being made by the local WI. But there you go.
Doctor, you've made your point, which I believe to be disingenuous. My right honourable friend can be reassured that there are testing facilities at your hospital, and they are state-of-the-art. World-class, in fact.
Fine. Every trial participant so far, when testing has been made available, tested negative.
And those tests are reliable?
But they're more reliable than the ones you send the public, for God's sake, what do I know?
I will not hesitate to disregard your evidence, Dr. Tulp, should you continue in this manner. May I remind you of the need for objectivity?
They have no symptoms. They also undertake continual self-observation. They take pulses every 15 minutes, perform random temperature checks, etc., etc. See? They all look pretty healthy to me.
Yes. They're not actually in the room, though, are they?
No, Minister. I would call it a Zoom meeting. None of you are. We are, though. Aren't we? We're here. Me and my shadow. Hello. I'm sorry. I'm being disrespectful. I would never do that. Anyway, I digress. We are still determining the cause of death. So what do we have? There is trauma. That's definite. An extended period of trauma. That wasn't just life, but life had a great deal to do with it. Judging by the lungs, I think there are some things that took your breath away. I mean, you used your lungs, but maybe you could have used them more. Did you sing often enough? I don't know. You touched things, made things, I'm presuming. It's hard to judge a life by its body. Maybe it's a side effect of the job, but I quite like my bodies to have a bit more movement in them, you know, for dancing. You look like you could have done some dancing. Some slight tendon damage. Your knees were okay. You broke a bone as a child, but you healed well. You were lucky. Someone loved you. The mark of a civilized society, that, isn't it? Someone will keep you alive when you mend a broken bone. I can't remember who said that, but it's good, isn't it? There's a lot if there's someone who will take care of you, bring you things. But that doesn't bring me to the end point, though, does it? I still don't know with you. Still quite hard to tell how you went in the end. What you came to. But look at the neck, look at the lungs. At the end of it all, you just couldn't breathe.
Please leave immediately. Do not interact with the new arrivals. Please reassemble promptly for the workshop at 6:15 p.m. Use the link in your email.